Are you aware of the recent spike in flu cases? Have you considered its potential link to COVID-19? We are living in an era where health news is more crucial than ever. Recently, various health sources have reported a significant increase in flu cases. This surge is not just a seasonal spike, it's uncommonly high, raising eyebrows among health professionals worldwide. The intriguing part is, there could be a potential connection to COVID-19. Yes, you heard that right. The virus that has dominated our lives for the past few years might be playing a role in the escalating number of flu cases. But how are these two interconnected? What does this mean for public health? These are the questions we should be asking, and understanding their answers is vital. As we navigate through these challenging times, it's crucial to stay informed, ask the right questions, and understand the implications of such health issues. Knowledge, after all, is our first line of defense. So, let's roll up our sleeves and delve into this intriguing topic. Stay tuned as we delve deeper into this matter and seek expert opinions. This season, we have seen an unprecedented rise in flu cases. According to the Centers for Disease Control and Prevention, or the CDC as it's commonly known, there have been a staggering 14 million cases of flu. Alongside this, an equally concerning number of nearly 10,000 deaths have been reported this season. These figures aren't just abstract numbers on a page. They represent real people, families, and communities bearing the brunt of this illness. The impact of this dramatic increase in flu cases is far-reaching, affecting our healthcare systems and individuals alike. Hospitals and clinics are once again finding themselves under immense pressure, with healthcare professionals working tirelessly to manage the influx of flu patients. Every bed occupied by a flu patient is a bed that could have been used for someone else needing urgent treatment. Every hour a healthcare worker spends treating a flu patient is an hour they could have spent on another critical case. The ripple effect of this rise in flu cases is indeed profound, straining our healthcare resources to their limits. The rise in flu cases also has a significant impact on individuals. People suffering from the flu experience a range of symptoms from fever and chills to severe body aches and fatigue. This not only affects their health but also their daily lives, disrupting work, school, and other activities. The economic impact is also considerable, with lost workdays and increased healthcare costs. But what could be causing this significant rise in flu cases? Is it a change in the virus itself, or are there other factors at play? Are our current strategies to combat the flu falling short? These are all important questions that need to be addressed as we grapple with this surge in flu cases. Let's explore. Interestingly, this surge in flu cases coincides with a rise in COVID-19 cases. As we delve deeper into this correlation, we encounter a rather concerning pattern. According to a Time report from August 2023, the public health emergency related to the COVID-19 pandemic officially ended in May of that year. However, as summer arrived, reported numbers of COVID-19 cases began to climb once again. The rise was not negligible. By August, hospital admissions had escalated to over 10,000 a week. Although this figure was significantly lower than the peak of 150,000 weekly admissions in January 2022, it is still a cause for concern. Now, let's talk about the new variant of the virus. It's reported to be more contagious, but there's still a lot we don't know about it. Is it more lethal? Is the recent rise in cases a temporary increase or a sign of a more serious surge? These are questions that researchers are tirelessly working to answer. What we do know is that the COVID-19 pandemic has had a profound impact on society. From fraying the social fabric and disrupting economies to deepening social divides and intensifying prejudices, the effects have been far-reaching. It's even contributed to an increase in violence and crime rates. Now let's circle back to the connection between the flu and COVID-19. As we've seen, both diseases have seen a rise in cases, leading to an increase in hospital admissions. This overlap between flu and COVID-19 cases raises some intriguing questions. Could there be a connection? Are the same factors driving both surges, or is it simply a coincidence? As we move forward, it's critical that we continue to explore these questions and seek the answers that will help us better understand and manage these health crises. To gain a better understanding, we sought the insights of health experts. There's a consensus among the health community that the rise in flu cases is intricately linked to the ongoing COVID-19 pandemic. Doctors and scientists have noticed a correlation between the two diseases. The head of the World Health Organization, for instance, attributes the recent increase in COVID-19 transmission to holiday gatherings and the spread of the Omicron variant, a trend that has been mirrored in the flu's case numbers. But why is this so? Well, as experts explain, both diseases are respiratory infections, spread through similar mechanisms. They are both more likely to spread during colder months when people tend to gather indoors, and both diseases can be exacerbated by travel and large gatherings, such as those that occur during holiday seasons. But it's not just about the spread of these diseases. The experts we've consulted also emphasize the impact on our healthcare system. Hospitals and clinics are dealing with a double whammy of flu and COVID-19 cases, stretching resources thin and putting immense pressure on healthcare professionals. So, how do we combat these high rates of flu and the ongoing COVID-19 pandemic? Our health experts suggest a multi-pronged approach. First, we must continue vigilant surveillance of both diseases. Second, we need to ensure access to treatments and vaccines. Vaccination in particular is stressed as a crucial preventive measure for both flu and COVID-19. The U.S. Centers for Disease Control and Prevention recommends that all individuals aged 6 months and older receive an updated COVID-19 vaccine that targets the Omicron variant, in addition to the annual flu shot. Lastly, the experts suggest that we need to keep up with preventive measures, such as wearing masks and ensuring proper ventilation. These measures, they say, are not just about protecting ourselves, but also about safeguarding our communities and easing the pressure on our healthcare systems. These insights provide a clearer picture of our current health crisis. So, what can we do to protect ourselves and our communities? The World Health Organization and the U.S. Centers for Disease Control and Prevention offer a few key recommendations on how we can help slow the spread of flu and COVID-19. Top of the list? Vaccination. Vaccines have been proven time and time again to be our best line of defense against these viruses. They work by training our immune systems to recognize and fight off these harmful invaders. So if you haven't already, make sure to get your flu shot and your COVID-19 vaccine. But it's not just about protecting ourselves. When we get vaccinated, we're also helping to protect those around us who may be more vulnerable to severe illness, like the elderly, young children, and people with certain health conditions. It's what's known as herd immunity. The more people that are vaccinated, the fewer opportunities the virus has to spread and mutate. And vaccines are just part of the equation. Other preventive measures, like wearing masks, can also play a significant role in curbing the spread of these viruses. Masks work by blocking respiratory droplets that may contain the virus, preventing them from reaching others. Ventilation is another key component. By ensuring that indoor spaces are well ventilated, we can help dilute any virus particles in the air, reducing the risk of transmission. This can be as simple as opening windows or doors to increase airflow, or using air purifiers with HEPA filters. Lastly, it's essential that we continue to practice good hand hygiene. Washing our hands regularly with soap and water, or using hand sanitizer when soap isn't available, can help kill the virus and prevent its spread. So there you have it. By following these simple steps, getting vaccinated, wearing masks, ensuring good ventilation, and washing our hands, we can all play a part in keeping our communities safe and healthy. Remember, prevention is better than cure. In these challenging times, staying informed is crucial. We've delved into the rise in flu cases this season and its possible connection to COVID-19. Experts have shared their insights, linking the resurgence to various factors, including the new COVID-19 variant and the recent holiday gatherings. Remember, these are not just numbers, they reflect our collective health and well-being. We've also highlighted the importance of preventive measures. Vaccination, mask wearing, and proper ventilation are not just recommended, they're essential. These steps could make the difference between a healthy season and a challenging one. And let's not forget the crucial role we each play in staying updated on health news. Knowledge is power, and in this case, it's the power to protect ourselves and our communities. So, as we wrap up, let's remember to stay vigilant, to stay informed, and most importantly, to take care of our health and the health of those around us. Stay safe, stay informed, and take care of your health. Thank you for watching.